And now on the line is Sheila Gilheany. Sheila is the CEO of Alcohol Action Ireland, as regular listeners of this programme on Nair FM will know. Sheila, welcome back to Nair FM.
Thanks very much for having me on, Darren. Thank you.
Okay, this week is National Brain Awareness Week, and I understand that yourselves in Alcohol Action Ireland are taking part in it, Sheila, and for the first time, I think it is this year. I am most familiar with the work of your organisation, Alcohol Action Ireland, when it comes to advocacy, lobbying and policy, Sheila. Can you tell me why and how Alcohol Action Ireland decided to take part in National Brain Awareness Week this year, Sheila?
Well, we do have a long-standing interest, in all elements of where alcohol intersects in our health and in our society. So, we would have certainly kept up to date, with any developments that are around that. But over the last couple of years, we have been working with the Neurological Alliance of Ireland, really to look a bit more closely at some of the issues around alcohol-related, brain problems. And one of the things actually that's very apparent to me is that we have a national strategy, the Reducing Harm, Supporting Recovery, which literally doesn't mention anything to do with alcohol-related brain damage. But it's something I think people sometimes when you talk about, health issues with alcohol, they'll probably fairly quickly think of, liver problems as being a thing there. But actually brain damage is another whole element. And this week, it is Brain Health Week, and we've been very pleased to partner with the Neurological Alliance of Ireland and with the HSE to run a campaign during the week to raise, I suppose, a few different issues because, there's quite a lot involved when we start thinking about the brain. So there's elements that would kind of relate back to sleeping, for example, for memory formation, but also in the wider sense of your mental health, with the impact that alcohol can have on things like depression, anxiety. So we've been exploring a number of those issues during the week, and we're very happy to do that.
Yeah, it's great that you're getting involved in the week, Sheila. Formally, I believe this year is the first year. And I understand that the Alcohol Forum, who are based in Donegal, are also supportive of the week this year as well, aren't they?
Yeah, well, Alcohol Forum would have had a long association around brain issues, and they would have had particular programs in operation there, supporting people who have alcohol-related brain injury. And it is something that we have been keen, to highlight that lack of focus, though, in terms of, what are the supports that need to be in place? What are the care pathways that need to be in place for people who maybe have a specific problem in relation to that? But I suppose just in this more general thing, we're just really trying to raise the awareness at a public level that actually, drinking alcohol, unfortunately, really can lead to a number of things. So, and some of the issues that would be there, as I say, poor memories, difficulties with new learning, balance, coordination, just changes in personality and temperament. Attention, actually, is a big thing. Concentration difficulties and sleeping, as I say, they're all elements, within, problems that alcohol can cause to the brain.
Yeah, I saw on Twitter this week that the Alcohol Forum have an e-learning module for HSE staff and for NGO organisations on alcohol-related brain injury. Sheila, does the term alcohol-related brain injury cover all the alcohol-related brain injuries, stroke illnesses in general, or are there different terms used around the world?
Well, there are different elements, I suppose, just depending on what it is that we're talking about. As I say, during this week, we've been covering quite a bit of it. One area that we have been looking at ourselves relates to, a type of dementias that can occur, from alcohol problems. One of those, there's, I suppose, the most extreme of them is known as Korsakoff's syndrome. And, that's one of those words that people don't really hear very much, but we actually think there are, large numbers of people in nursing homes with, a variation of a dementia, which actually goes back to a kind of a combination of, high levels of alcohol use and problems with diet as well. And yet, as I say, this isn't something that has actually really come up within our overall strategy of looking at alcohol use and trying to reduce the levels of alcohol harm. So we have been working with the Neurological Alliance of Ireland, to raise, to raise that issue, but also to try and put forward some suggestions that maybe could help. And one of them in particular is that we definitely would like to see, a clear indication of what would be the care pathways that would be needed there.
Yeah, I agree with you that the whole issue of alcohol in the brain is not, it doesn't get as much publicity as it should. And I understand that there are kind of two related alcohol dementias you can get, but one of them, at least, it's called alcohol dementia for one term, but it's not actually progressive. So if you stop drinking, it'll be the end of it. Like, you know what I mean?
That's true.
That's true.
Yeah. It depends just on how far or what damage has been caused, but it can be pulled back, which again is very much about this sort of awareness week that that you really can turn things back by reducing the level of alcohol, and we would certainly encourage people and family members who might have a concern this way to seek medical advice on that.
Okay, it's a huge issue. I'll talk to you again about it. Just this time next year for Brain Awareness Week 2024, I don't know if you're going to be taking part in the book. Can you tell me what on this area you'd like to have been achieved by this time next year?
Well, I think within the within the HSE, we would really like to see it being absolutely clear, what element of the HSE, where does responsibility for this lie? Because, I really do see it as a complex area. It covers, a neurological condition. It also covers, things like people being in nursing homes and care pathways, who exactly would be responsible there. So I'd love to see just a clear focus within the HSE, able to lay out what needs to be done, and then I suppose to take the initiative of what's the funding that's needed around that. But I think that is a very important thing to get clear within the HSE.
And just thinking of it now, the whole issue of fast fetal alcohol spectrum disorders, that's kind of brain injury as well, isn't it?
Yeah, absolutely. It's a neurological, developmental problem, which arises when the fetus is exposed to alcohol in utero. And we know that Ireland, unfortunately, has the third highest level of FASD in the world. We estimate that there's something like about 6,000 babies are born every year with this condition, which is a lifelong condition, and of course is also variable, from person to person, as to how particularly they are affected. But there is again a lack of a care pathway. There's a lack of diagnosis. There's a lack of support for individuals and for their families, and really a lack of recognition that of the scale of the problem that's there. Now, the HSE have actually put out a developmental paper, about this, and I've actually been saying that there is a need for across government, across departmental strategy on this, because as you can imagine, different problems emerge at different times and maybe can be affecting a child or an adult in different ways. So at school, for example, again, you can have that thing about memory being a problem and concentration. So that has implications, obviously, in the classroom. And there's also health considerations around FASD, both mental health, but actually physical health as well. There's a lot of different conditions that are actually associated with it. So there's a multiplicity of different areas that we really do need to be looking at. And I'd be very encouraged when I'd look at other countries, so for example Scotland, Canada, have put in place very comprehensive programs around diagnosis, support, therapeutics, that can be, help to ameliorate, some of those symptoms and conditions that occur. So it is a really, really important element of brain health, is to look at FASD.
I know that yourselves in Alcohol Action Ireland, and I think all organisations working in public health in Ireland, I know there, as I said, I don't think there are any public health organisations aren't calling for the prohibition of alcohol, but is it true to say that over the last few years that reports are coming out saying that there is no safe level of alcohol for your health?
Yeah, I mean, the World Health Organization would say that there just isn't, and like I say, we're not talking about prohibition. We recognise that, it is very widely used, and there's a social acceptability obviously, with that. But all we would ever do is just sort of to point to whatever evidence is being produced. And as I say, the World Health Organization did make that statement, and have made that statement, very, very clearly. There was a very good paper published on it at the start of this year. And I think it's just one of those things that the more research is done in different elements, whether we're talking about liver disease, whether we're talking about heart disease, cancer, brain injury, FASD, or social impacts, on people, or mental health issues, but essentially, when you look at something in more detail, and when you look at kind of, the impacts of alcohol that's there, you just, all you can see is evidence that it does cause a lot of harm and a lot of difficulties. And what we're in favour of is that just simply letting people know that harm, and letting people, I suppose, make up their minds about, what they may or may not do. What we think it is important is that there should be a reduction in the level of advertising and marketing that people are exposed to, because right now people are making decisions about, using alcohol, and they're, if you like, their primary educator on this is the alcohol industry through, the saturation levels of marketing that we're exposed to right now. So, for example, we know that there's at least 115 million euros worth of alcohol advertising in Ireland every year, at least that amount. Whereas if you were to compare that to the HSE Ask About Alcohol information programme, I think it had funding last year for about €66,000. So 115 million versus 66,000. I would really question, are we able to make informed decisions when we're subject to that level of alcohol marketing?
Yeah, and you might have answered this already, but I think most people know about the societal damage that alcohol does as regards the weekend, hospitals, violence and stuff, but even for your health, apparently you're saying, according to the WHO, there's no such thing as a healthy level of alcohol, is there not?
No, there isn't.
Okay.